to the next item on our agenda, impact of WHO reform on the work of WHO European region. The relevant documents are Euro/RC68/15, WHO reform, new strategic vision and transformation plan, and Euro/RC68/8L, which is the progress report on the governance reform in WHO European region. The adoption by the 71st session of the World Health Assembly of the 13th General Programme of Work 2019-2023 has important implication on the new way of working of WHO across the three levels of the organization to make an impact at the country level. The adoption of the General Programme of Work is therefore accompanied by a process of reform and transformation of the organization's operational model and culture. In the European region, this information builds on the work initiated by the Regional Director at the 60th session of the Regional Committee with her Better Health for Europe vision. This vision has governance as one of its key priorities and over time has already led to several reforms carried out together with the Standing Committee of the Regional Committee. I would like to invite Dr. Tedros to give an overall introduction on the ongoing transformation, followed by Dr. Nedret Emiroglu, Director of Program Management on the regional work on this regard.
Bernard Schwartländer will give the introduction.
I'm sorry. On behalf of the Director General will be Dr. Bernard.
Dr. Bernard, I have delegated my Chief of Cabinet.
Thank you, Chair. Honorable Ministers, ladies and gentlemen. I have the great pleasure to give you an update on the work on the transformation that we are undergoing, that we are planning, that we're working on. And it's quite a task. As you will see, there's a lot of work going on, and I try to really have a short, concise presentation because one of the principles, and we come back to that later, is that we are really here to listen. Not only here, we are here to listen also as we engage in the transformation rather than to give lengthy presentations, and then I hope we can address any suggestions, concerns you may have in the session following. The transformation is, of course, firmly grounded in the Constitution of the World Health Organization. It's firmly grounded in the SDGs, and it's firmly grounded in the UN reform. But it also builds on the significant work that has been ongoing in terms of reform in the World Health Organization over the past decade, and in particular also in this region, and my colleague Nedret will report on that work right after me. The first step in the transformation, of course, must be to have a clear strategy. How can you transform, how can you improve an organization unless you understand where you're going? And that's fundamentally the global program of work, and that's fundamentally the strategy that we have. And we have finalized the strategy actually ahead of time, and the main reason for doing so, to be 1 year faster than originally planned, is to have this strategy in place as we engage in the transformation. So we could really have the purpose clear, and we have a clear purpose with the strategy that has passed the assembly just earlier this year. The global program of work clearly articulates who we are, what we will do, and of course, most importantly for the transformation, how we will do it. The strategic plan provides a clear direction around which we can align all of our WHO staff in support of member states and the SDG agenda. It focuses on a number of strategic and organizational shifts that are nicely lined out in the paper that's in your pack. What's new in the Global Program of Work 13? WHO will base GPW 13 on the SDGs. It will measure impact, it will prioritize, it will step up leadership at all levels, and WHO will drive public health impact at every country. And the DG has already spoken to that. We will strengthen our normative work, and will transform our approaches to resource mobilization, and will act with a sense of urgency and quality, and I can guarantee you that's not always compatible with a work-life balance. With the strategy in place, the transformation will focus on how we will do it, of course. At the core of the strategy, and I just remind us, is of course the triple billion target, which firmly anchors all of our work in impact for people around the world. The transformation goal is actually nicely summarized, and I can't say this any better, in the quote of our Director General in the EB earlier this year. Our goal is clear: to make WHO a modern organization that works seamlessly to make a measurable difference in people's health at the country level. We do this without losing sight of the core values of this organization and the core mandate of the organization, in particular, our technical excellence and our role in norms and standards. As we engage in this process, I would like to highlight sort of a three-prong approach. First, and I mentioned this already, we listen. Second, we analyze. And third, we manage, and I come back to that later. We listen first and foremost to our member states, and today's session will be part of that. We listen to our staff around the world. We have actually engaged very early on in the transformation process in the staff survey, and almost 2/3 of all staff of the organization around the globe have participated proactively in this survey, and we have been told that this is best in class. And of course, we're looking at our partner environment. We analyze. We have engaged in a detailed process mapping, because unless we clearly understand how we are currently doing business, we cannot really improve. We are benchmarking as we're doing this work. We are comparing ourselves to other organizations, and we have the clear commitment to become best in class. And we have brought innovation to how we engage external partners and external experts in this process by bringing in a number of consultant companies that have different comparative advantages, but they're usually competing with each other for contracts, not working together. But by bringing these companies together, asking them to work together, we want to get the best of the best, which is in line with our drive to be the best of the best as we compare to our benchmarks. This process has not been without pain, as you can imagine, that as these companies found themselves in a very awkward situation initially, with all their competitors sitting around the table, but it shows the first results, and we are convinced that this will lead to excellent outcomes. Let me briefly summarize key focus areas that have emerged out of the listening and out of the analysis. First and foremost, of course, the shift in focus from outputs to results and impact. The second, to ensure that our normative work has country impact. And I think it is critical to understand that by no means, and I've heard very carefully some of the interventions also today, that you're concerned that with our shifts to more country focus, we would lose the focus on norms and standards. This is not the case. The idea is that as we engage in our global work in norms and standards, we never lose sight that these norms and standards have to have impact at the country level. They have to support our partners, the member states and other partners, to improve delivering health, and this is at the core of our work. We standardize core processes to facilitate WHO's work by making them leaner, to making them more effective, and we optimize culture for collaboration and performance of our own staff through creating incentives, but also to creating a new clarity of purpose, what we are about, and by creating an agile environment that we are working in. And we are right now engaging actually in the first example of that as a test case, how we unfold the work, which will be focused on primary health care, which I think is very timely, not only as it's at the core of the agenda on universal health coverage of the GPW, but is also very timely with the upcoming conference in Astana that has already been mentioned here. And finally, we have to address earmarked and unpredictable fragmented funding. Just one number. Of the more than 3,000 grants that are currently under management, and that's the way how we receive money from our partners, from member states and other partners, almost half of those are grants that have a value of less than $200,000. This is not the way how to move global health. Let me very briefly summarize where we stand in the big picture, and we're happy to engage with you in a more detailed discussion wherever you have questions. The 13th General Program of Work is unfolding with the program budget, and that's going to be the focus of the next discussion. But you have seen that we have redesigned a new process which puts the country at the center in a way that we have been talking about before, but we haven't really done it. We are unfolding new planning and budget processes, which, again, we will discuss, of course, but we will also focus on performance management. We will focus on talent management for the organization at all levels, recruitment, and supply chain processes. We're looking into a new predictable WHO country office delivery model, and I know that you have questions on how this will unfold, and we're looking to work with you to make this really work so that we have the right capacities, and I think that's the point. It's not just more people, it's the right people at the right spot with the clarity of purpose in headquarters, in the regional offices, and in the country offices to deliver the very ambitious program of work that we are putting forward. And we will have to focus on our values in the organization. We have to shift the way we work with each other in headquarters, between the two levels of the organization. We will have to tear down the silos. We have to focus on systems away from diseases without losing the focus, of course, on diseases, because ultimately that's what people worry about. And we have to shift to new and agile ways of working, and I just mentioned that already. But last but not least, we're also launching in just, I think, 2 or 3 days from now, on the 19th of September, WHO's first investment case and a financing campaign. Some of you will hopefully be able to join, or your colleagues who are in Geneva. It will be also launched in Geneva. But we see this as an ongoing process. This is not a one-off campaign. This is a campaign that engages all of us together, where we want to actually get away from resource mobilization that's focused on specific projects, that's focused on departments, that's focused on clusters. We want to have a resource mobilization that addresses the ambitious goals of the organizations, the $3 billion, and within that, of course, the work that all of the departments, all of the clusters are doing. Let me come to the last point, and I mentioned this before, the way we manage. We are building on the excellent work of the previous Director General, who has actually established the Global Policy Group, the GPG. This group now meets on a monthly basis. We bring in some of the WRs to key discussions in the transformation process to really have a consistent leadership and a commitment of the leadership at all levels to drive this process forward. It's an incredibly ambitious process. And I already mentioned, it's not always good for a work-life balance, but the vision that we have, the results we try to achieve are equally ambitious, and that's why we're here. Thank you very much.
Thank you very much, Dr. Howard. Now I'd like to invite Dr. Emiroglu to continue.
Thank you very much, Executive President, dear DG, Regional Director, Honorable Ministers, delegates. It's a pleasure for me to give you an update on where we are with the WHO transformation in the European region, following actually Bernard's overview on the global efforts. As mentioned by the Regional Director in her response to her speech, this is not new in the European region. So we have been working on, from a regional committee document in 2010, when the regional director, when she was newly appointed, was sharing her vision and manifesto in 7 strategic priorities. And this is the process that resulted, among other things, in the endorsement and implementation of Health 2020, as well as a strengthened governance with your help and the Standing Committee for the Regional Committee's oversight, a stronger governance mechanism within the European region, a closer collaboration with the European member states, again demonstrated by your comments at the previous session, and the establishment of a national counterpart system with as the focal point with the all member states, which provides extremely effective and efficient communication channel. And given its high compatibility with the global WHO transformation, what we call Better Health for Europe has been our springboard to jump aboard on the transformation agenda. So it was good for us to be able to build on what we have been doing before. So in a nutshell, what we have done, the European region is now fully integrated into the global transformation architecture, with the regional director being extremely active at the global policy group supporting the DG, and also various staff working in different work streams and having a representation from regional office at the very senior level, as well as the WHO country office staff. So there is a directors of program managers, which is looking into the more operational areas. There is a director of administration finance who is looking into the administration finance process procedures to streamline and to be able to make it more efficient. There is another external relations, resource mobilization, communication group with DG's new vision, bringing all these elements together with partnership to be able to deliver better. And there are also different groups who is looking into what is it that we need to do in terms of technical collaboration with the member states. What is the best way of supporting them? What is the best way of having some standardized normative work which is going to help all member states, or data and information management? So these are some work streams that we have been very actively engaged. I have to say that this has been taking quite a time of our staff, but it has proven to be extremely effective. So now we have a regional coordinator who is working on following as the focal point, and a team of also WHO regional office transformation team. These are add-on work, so we don't have special staff assigned for it, but mostly engaging in the current work. I'm not going to dwell too much on the GPW bottom-up planning, which is and the program budget, which is the next agenda item. But this was one of the examples of using the examples of the transformation. And we have been using each and every platform to discuss the transformation, to bring the knowledge and culture change and the mindsetting change at all levels. It was at the executive manager levels with the RD, regional director and directors, program managers, general staff, all staff. And actually, after the regional committee on Friday, we are having a retreat together with the WHO country representatives to again discuss both the transformation as well as how to be better prepared for GPW and Program Budget 2021 planning. Another important component has been the follow-up of the culture survey results. As you have heard from Bernard, there has been quite a high turnover within the overall organization as well as the 66% within the European region staff has been contributing at all levels, professional, administrative, and at different level. And actually this survey gave us extremely useful insights on how the organization could become more effective in creating and promoting stronger organizational culture based on the shared values, managerial approaches, and more on building upon its asset, which is the staff, who is highly competent, motivated, and with the best skills. So we are taking that extremely seriously. We are looking into the details of whether there are any concerns and trying to understand better what those concerns or impediments are and how we could overcome them. And we are also engaging all the current structures like the Respectful Workplace Initiative, the staff associations, staff learning and development work, and so on. And this is in resulting in a European action plan, which we are gradually implementing. And also we have been now engaged fully into what we call is the European Change Network. These are the staff who has been appointed by their peers as the change agent, and it is in the regional office, in the geographically dispersed offices, in the country offices, and they raise the awareness, they lead the dissemination of information to bring everyone onto the same level. Just one slide on the WHO governance reform, which is not new to you, and we have been discussing that in every regional committee in the previous years. And thanks to the ongoing work of the Standing Committee for the Regional Committee, its subgroup on governance, and their support to the process, we have gone a lot in being able to implement the decisions that has been taken. So we have strengthened several important aspects of the regional governance of the organization. The work has delivered strong alignment with the global governance mechanisms, made the nomination processes, both for the governing bodies as well as the regional director, more efficient, clear, and transparent. And also, we believe it also improved, made more efficient the management of the governing body's agenda, as well as presented a good process through the member states decide on the development of resolutions and on high-level political events like the ministerial meetings. And there is the document is providing additional information as a separate document on what has been happening in the WHO governance reform. So as a closure, we have also a good website, internal website, which is the repository of all the information on the WHO transformation that staff could get into. We want to also improve the website so it could become also a response and bringing new elements and innovative ideas. And we hope that this is bringing as a transparent tool to engage all member states. So thank you very much for your attention.
Thank you very much, Dr. Nedret. Thank you very much, Dr. Bernard, for your clear and interesting presentations. I now open the floor for the discussion. Delegates wishing to speak on the issues, please raise your name plates. I don't see. Switzerland, please. Followed by Germany.
Monsieur le Directeur Général.
Director General, Madam Regional Director, Chair, delegates. Switzerland would like to thank you for this document entitled WHO Reform, and we welcome the fact that it does take due account of the 13th GPW and its implementation at regional level. Having a strategic vision that puts countries at the heart of what this organization does is at the very heart of the 13th GPW, and that's a big challenge for the European region. That being so, looking at the normative and scientific work done by WHO, we must ensure that the high level is maintained, and we wish to have more information as to what tangible form field presence in countries will take and what that will represent in structural, financial and human resource terms. Bearing that in mind, WHO must be more consistent in the way that it uses the resident coordinator system. It also must coordinate more effectively and consistently with other UN agencies and ensure that it takes its rightful place within the UN family. As is emphasised, alignment with UN planning cycles has not been sufficiently taken into account within the 13th GPW. Such alignment is especially important because it can only enhance the contribution made by WHO to ensuring the goals of global health. In conclusion, we wish to encourage the European region to highlight good practice and take that practice forward so that we can make progress in the global reform discussion. Thank you.
Thank you, Switzerland. Germany, please, followed by Turkey.
Herzlichen Dank. Sehr geehrte
Thank you very much. Ladies and gentlemen, Germany would also like to express its thanks for this document and for the presentation made by the Secretariat. It was a very useful presentation indeed, so thank you, Bernard. We found it very valuable to hear this presentation on the transformation plan. We want to have a modern WHO, a WHO that can play a key part in organising health policy at global level. We know that WHO does have a pivotal part to play in ensuring that we are better placed to meet new health challenges that will arise in the future. And we need to look to the future and look at what will be required of us there. We believe that member states, those who after all own the WHO, must be fully informed in the process. And that means that they have to be consulted and involved when major decisions are taken. There are a number of things that need to be done. This transformation plan is not something that should be undertaken without member states being fully aware of what is happening. And I'm sure that when we come on to discuss governance in more detail, we'll be able to go into that particular issue in more depth. The second point I'd like to make is that we need to focus on what WHO does at country level. We wish to commend the objectives that have been set for WHO's work in different countries. But we must ensure that we properly clarify the role and function of WHO at country level. That is vital if we are to be successful. We believe we need more discussion of this in Geneva, and we also need to look carefully at the way in which the Geneva-based governing bodies can give better guidance to the work that is done by WHO in various countries throughout the world. That's my second point. Moving on now to my third point, UN reform. We think that it is crucial for us very shortly indeed, here and in Geneva, to get down to discussing the impact of UN reform on WHO's work in different countries throughout the world. We need to understand that UN reform is something that is decided upon in New York. But in New York, the UN doesn't always properly and fully understand how the specialized agencies operate. We think we need to have a transparent discussion about this in Geneva, and we need to have that very quickly. That was my third point. My fourth point, in fact, Idret has already mentioned this. WHO has resources, and its central resource is the people working for WHO. It's human capital, those working in Geneva, in Copenhagen and elsewhere. We need to invest more in our people. We need to ensure that WHO's working methods are in line with the most up-to-date standards that we have. This means we have to have gender equality and parity properly reflected, as the Director General has said. It also means we have to look at modern working methods, teleworking, flexible working hours, and so on. We need to look at these cutting-edge practices, and I think we need to discuss all of this in detail in Geneva. That was my fourth point. My fifth and I believe final point is this. We need to think about how we deal with matters that arise within WHO. We recognize there are different levels of WHO, and they work together very closely within the GPW. And that is something that we have to continue to see in the future. I'm sure the new DG is very much aware of that. Thank you.
Turkey, please, followed by United Kingdom.
Thank you very much, Mr. Chair. Turkey has been a long-standing and active supporter of WHO reform. I would like to underline the necessity of balance between expected progress and the ways to success. I highlight the leading role of member states and governing bodies in this process. As a member of EB and SARC, we would like to emphasize the importance and the responsibilities carried out by the governing bodies, particularly the Executive Board regarding the governance reform. Effective use of the EB carries immense importance in order to reduce the burden of the work and the intensity of the World Health Assembly's agenda. In this regard, we believe that SCRC stands as an exemplary model considering the role that it plays in terms of reducing the workload of RC for Europe. In order to give visibility to the governing body's meetings and allow us to implement the decisions we take, we must focus on the most important issues and therefore consider reducing the agenda of the governing body meetings with prioritization. While proposal of new resolutions remains the right of every member state, we notice the need for a more disciplined approach to exercising this right. Finally, I'd like to underline the alignment with the UN reform process and the importance of embracing the best practices from other UN governing bodies in this process. Thank you.
Thank you, Turkey. United Kingdom, please. Followed by France.
Thank you, Chair. And thank you to the presenters for their interesting and informative presentations. Would like to thank the Regional Director for her proactivity in this area and her strong input through the Global Policy Group. The reform of WHO continues to be of high importance for the UK. In considering the Strategic Vision and Transformation Plan document, we welcome the work done by the European region and the assessment that existing policies like Health 2020 place us in a good position for delivering the SDGs as well as the GPW. We look forward to the development of regional action plans, recognising that different regions will require different delivery models. This is clearly linked to the next item on programme budget development. We welcome establishment of global change networks and the 3-level working groups. However, the paper is also quite tantalising, touching as it does so lightly on many important aspects. We therefore look forward to hearing more and the full engagement of Member States, and in line with many of the comments made by Germany. In particular, the updating and refinement of the impact framework, the programme budgeting guidelines and the investment case. These are vital underpinning elements to the delivery of the 13th GPW. It is important that the WHO does not relax after getting the GPW agreed. It is now essential to push on with implementing it, and attention must be turned to the organisational shifts. Before closing, I would just like to touch on the governance of the WHO Regional Office paper, and again thank the region for their leadership. There is much to learn from this region on review of resolution reporting requirements and timing of submission of resolutions. It's important that we continue to lead the way, including on transparency, such as the filling of elective roles like Bureau membership. We welcome the steps you have taken, but it is something we must keep under review as the discussions progress. Thank you.
Thank you. United Kingdom, France, please.
Thank you, Chairman. Regional Director, Director General, Chairman. France would like to extend warm thanks to the Regional Director for the quality of her report, which follows up on the adoption of the 13th General Programme of Work by the WHO Health Assembly. We hope that the reform and the transformation programme of WHO will be part of the general reform of the UN system, in which WHO must of course be closely involved. France also welcomes the strategic reorientation emphasizing the normative functions of WHO. We hope that will provide better support to those countries that need it. At the same time, however, the repositioning of countries within the center of WHO's action does raise certain questions which remain to be answered in terms of cooperation with other UN agencies and links with resident coordinators as well from the financial point of view and the point of view of the allocation of human resources. We also believe that the preparation of forthcoming biennial budget should be based on a more realistic evaluation of the ability of states to mobilize resources. We would reiterate our attachment to the financing dialogue once the next 2020-2021 budget has been adopted. France believes that consultation on these forthcoming biennial programs should take into account national priorities and that they need to be looked at and discussed in more depth with member states in order to ensure that they are relevant. It is somewhat regrettable that the consultation has taken place in too short a time. On reform of governance, France welcomes the agreement which has been reached on a list of questions which can be settled by the Director General without further delay, without any change to the rules of procedure, and we will monitor the forthcoming debates on these issues extremely closely. Thank you.
Thank you, Franz. I don't see any other requests for interventions. Then I would like to ask Dr. Bernard to respond to the comments and questions. You have the floor, Dr. Bernard, for respond.
Yes, thank you very much for the excellent comments of the member states. It's always difficult to find the right balance in the presentation, not to give too much detail, but then also not too little. And obviously, there's much more detail that we could provide, but there's also so much more work that needs to be done that we are very happy to engage in this dialogue with you today. I heard from a number of member states that there is an eagerness to learn more about how does the approach to put countries at the center really work. I heard the issues raised around the human resources, the capacities, but also the budgets. I'm a little bit surprised sometimes, I mean, I understand that, but sometimes we're probably not doing full service in the way we communicate, because the member states, of course, are closest to our country offices in many ways as we design our strategic plans, our cooperation strategies. And I think the core of the discussion of the shift here is that we really want to align ourselves with the SDG, the development agendas in the countries. We also want to go global in that we say this is not only, like the more wealthy countries giving resources to the poor, but health matters everywhere, that we want to engage with all countries in a policy dialogue that's fundamentally based on our normative work and our standards, of course, and the excellence of evidence that we try to compile. So the focus on countries is much less that we say we need much more money there. We want to move a higher share, a greater share, of course, of the total budget to countries, because we do believe that this is where the action matters most. But it really is the quality of the work that is most important, and of course getting the right capacities to where they're needed. This may mean very different things. This may mean in some countries that we need a specialist who can work in a certain area, and be it in universal health coverage and systems, but also in specific diseases. But it may also mean that we have to greatly improve our management capacity in countries that are very vulnerable, that have massive challenges in the way, in health security issues, where we just need to do much better in procurement, for example, be much faster, much more efficient. So that's the type of work that we are foreseeing country by country to be worked through, and of course our regional offices are in the lead in this agenda. There were some comments on the governance reform, and they were specifically, I think, also mentioning the work that's being done in the region, and I refer those to the region director. I also heard that there is a need to be more clear of the impact of the UN reform. And I know that the Director General will have some summarizing comments later, but it is very clear that we want to be a very active and constructive partner in the UN reform. The basic decisions have been taken. This is not up for discussion. The RC coordinator system, reform of the RC coordinator system has been taken. It's a decision of the member states. We want to be part of shaping it. There's still many open questions, as you're much aware from the discussions in New York, from your colleagues in New York, but we want to be part of that. In many ways, the success of these good reforms will depend on the people implementing it. I think that's one thing that we collectively learned and we collectively debate, as we engage in these working groups, and that holds true, of course, for the new resident coordinators as much as it holds true also for our own representatives in countries, and we will need to engage in an effort to capacitate staff, and that was mentioned as well, to really be ready for the task, be it in the implementation of the GPW, but also be it in the way we want to work with others as part of the UN reform. We would very much welcome alignment between the different governance bodies, of course. That always is also a challenge, that the same countries, the same member states sit on different boards of different organizations with slightly different guidance given. Alignment here will be critical as well, not only at the country level, but also at engagement in the global level of these different organizations. And we would be very, very eager to learn and to work and learn with you how that can be done better. There were some discussions, there's some questions, in particular from France, on the budget. I wonder whether that would be better covered under the next agenda item, a more realistic budget where we could present this, and of course, in general, the eagerness to learn more and also have the opportunity to discuss these matters in Geneva governance meetings as well, and we will review how that can be done, but I refer to the Director General on that as well.
Thank you. Dr. Nedret, would you like to respond to questions specific for the European region?
Just maybe I could give some of the European preparation aspect, even though I think we will have more explanation at the next session when we are giving you a feedback on the program budget 2021 prioritization. But as the Secretariat, we started the process on looking at the countries, and at the center is not new in the European region. That has been going for a long time. But within the new GPW perspective and looking into the program budget, we started doing our work, which I will present you. We don't have the concrete numbers yet that you have been looking into, but we are critically looking at what is the country's priorities and needs are, and what does the Secretariat need, what is the technical capacity that is needed to be able to deliver this need, and whether it could be, where is the best location for that? Is it from the regional office? Is it through the geographically dispersed offices? Is it a multi-country approach, which then one staff or a group of staff could cover more than one country? Or whether it is the capacity that is based in the countries. But that is going to be going hand in hand. We have some preparations, some projections, but that needs the whole planning process to be finalized. And we are happy to inform and involve you in the means and ways that you're going to advise us. And I hope also I agree that motivating staff and investing into them is one of the priorities. That's why Regional Director has been putting it as one of her priorities, the results of the culture survey and the follow-up results, and bringing all the different initiatives together to empower the staff and to motivate staff and to improve their skills and capacities is at the heart. And then thank you very much. I think we take your compliments on some of the European good practices which we are sharing, and RD is also at the Global Policy Group actively giving some of the examples we do on governance, or some of the country visits, which was by the standing committee, by the regional committee, was another reason to expose you to the work we do to better understand what WHO operates, and then what kind of a guidance you will give in terms of country presence. Thank you very much.
Thank you very much, Dr. Nedret. Director General would like to.
Okay, thank you. I think our presenters have already addressed many of them. I just would like to focus on a few issues. In the reform, one thing that we're trying to consider is that all we do in the reform should be to realize the SDG goals. There cannot be reform without a purpose. So the purpose is SDG goals. Then in the SDG goals, as you know, if you take the SDG 3, the health goal, and the goals, the targets for the next 5 years, that's what we put in the GPW 13. This is the triple billion. 1 billion healthier population, 1 billion protected from emergencies, and 1 billion who have access to basic health services. That's the universal health coverage. That's what is in the SDGs. So we didn't reinvent the wheel. So it's reform with a purpose to make sure that the SDG goals can be achieved, to make sure that we give or contribute our share to realize the goals. That's one. And then second, since we're talking about SDGs as a purpose and the reform is done to achieve those, it has to be aligned with the UN reform. And we had a very good meeting with our country office heads yesterday. And we summarized the UN reform as actually opportunity for WHO. And for the people we serve, the one UN family approach is essential. So there is one UN family on one side, and there is the whole government. Of course, there are other players too. Then there is the SDG goals at the center, which we all have to be committed to implement. Meaning, at the end of the day, the common factor is serving the people who need our service. That's it, nothing else. So be it the government or the UN, when we work as united force, it's the people we serve that are going to benefit. And all we do should be guided by that. How best can we serve our people or the people who need service from us? And that's why aligning our efforts with the UN reform is important. And from WHO side, we're determined to make sure that the UN reform is a success. But at the same time, while accepting this and doing our best to make it happen, there will be some details that need to be addressed, like what our friend, colleague from Germany said, the normative functions of organizations should be understood, because all is not in SDGs. For instance, WHO's normative functions cannot be addressed through the UN country team, because it's science and evidence based, so it doesn't need any interference. It's not going to be a collective responsibility. It will only follow science and evidence. And some of the behaviors of the specialized agencies we believe will also be addressed. And that's what exactly the Secretary General himself had said. But even having said this, there is really a strong position from all of us to be involved in the UN reform fully to realize the SDGs, because almost all of the stakes are in the implementation of the SDGs. And then the UN reform itself is for a purpose. The reform is for a purpose, what we do in WHO, and the UN reform for a purpose, and both of them to realize the SDGs. The other area that I would like to underline here is then those things that we do or we change to achieve the SDGs or to achieve the goals that we have should bring a comprehensive change in the organization itself. Meaning, by introducing management tools alone, change cannot come. Management tools are important, but changing the culture or the mindset is even more important. It's more important to have the right mindset and wrong tool, because if the mindset is right, you will always find the tool, rather than the wrong mindset and the right tool. But the mindset and management tool will be important when we think in terms of reform. It may take time, but considering both the management tools and the mindset will be important. That's why to change the mindset, we had a cultural survey. We understand now what the challenges we're facing are, and we are preparing an action plan to address the cultural issues. But cultural or mindset issues cannot be just changed using orientations. It's when we start action using the new goals that even the mindset itself can change. Then in terms of processes or the management tools, the approach we're following is, first of all, we have prepared already the exhaustive list of all processes that need change, be it technical or managerial. And then we have started to map the as-is, how we're doing the processes now, plus finding new designs by benchmarking successful organizations internationally. So when you benchmark processes from successful organizations, the aim is either to excel that best practice or to at least perform as much as that. And be it in performance management process, in recruitment, or in supply chain processes, or in the technical, be it in technical cooperation processes, policy dialogue, norms and standards, data and innovation research, we're trying to benchmark the best and trying to take that benchmark and, if possible, excel, or if not, at least perform as much as that. And through the approach that we're now trying to implement, we believe that the organization can really change significantly. And that's why, as what Bernard said, we have even done something unorthodox. We have brought competing organizations to help us. They normally compete, but we told them to come and join forces and to give us the ideas that can modernize WHO. This is very difficult even for the companies themselves because they are competitors. But they're working together, which is very important. They see things from different angles. They have their own comparative advantages. And they're giving us good advices to make WHO as modern as possible. Change takes time. As soon as I started, people were really nervous even in the organization because they thought change means just changing the structure and showing where people will be just in relation to where they would be positioned. Change is not about changing structures. Change is about changing the processes, changing the mindset, changing the operating model, and making the organization as ready as possible or fit for purpose to achieve the purpose or the goal, the SDG goals. There cannot be reform without a purpose. And if it's real change, it takes time because it has to be done consciously. And it cannot be done in a very amateurish way. It needs experts. It's only with the assistance of experts in WHO, from outside experts, that we can bring change, we can reform it. You can't build this house without involving engineers who can do the job. You need experts. Even reform of organizations, which is mainly focused on software, needs expertise. It cannot be done by us without expertise. And the end result, an agile organization that's as modern as possible and which is ahead of the curve and which can contribute to the world in terms of global health contributions. And it's time, as we have already seen from our analysis, for WHO to change significantly at all levels. And that's exactly what we're trying to do. And hope we will make some changes, but as I said earlier, change needs time. We shouldn't give up. We need patience. But with perseverance, then the change we need can come, and we can make WHO an organization that's fit for purpose. And as our colleague from Germany said, we will share with you the progress, we will consult you, we will ask your guidance in order to make the change owned not only by the Secretariat only, but by you too. So we will do that, and we hope we will make our organization better organized to serve the people that we are expected to serve. At the end of the day, that's, I think, what's expected. Then on one final thing, on partnership, one of the changes we're making is, in WHO, we have risk-avert behavior. We have to move from risk-avert to risk management. As you know, member states endorsed FENSA, but FENSA is not a fence. It doesn't prevent us from engaging. It only puts guidelines to avoid conflict of interest. In order to implement SDGs, we should really believe in partnership. WHO cannot achieve what it's saying it can achieve without embracing others, including the private sector and civil society. And that's why we're opening up. I don't want to go into details, but there should not be conditions for engagement unless it's a tobacco or arms industry. The rest, based on FENSA, we should engage. And from risk-avert behavior, we should move into risk management. What matters is the objective we want to achieve, the goals we want to achieve. And the risks can be taken into consideration and addressed by focusing more on achieving the objectives we are set to achieve. There will always be risk. We have to be prepared to take risk. We cannot be afraid of risk and do nothing. I think the consequences of doing nothing should be more than actually doing something and fail, or taking risk and do something. That has actually should be rewarded. And that's the kind of mentality we're trying to follow, and the kind of mindset that we're trying to follow. And last, when we do this, change cannot happen in Geneva alone. And that's why we had the presentation from the region. We're aligned at all levels. We're trying to align at all levels. There should be alignment at all levels. And what we do should have clarity at all levels. And what we do should really reinforce each other. And that's the other principle we're following. Then all the support from the headquarters and region being to make sure that we make a difference, or there is impact at country level. Because change can only come, or impact can only be obtained at the country level, nowhere else. And even the normative functions we develop can only give sense when they're implemented at the country level. When we say focus at country level, it's still to keep our major stake in the normative functions, but make sure that the norms and standards are implemented at country level. We have many norms and standards in our shelf. Because of the weakness of our country offices, it's not being implemented. So that's why there is a need for strengthening our country offices, and whatever change, reform, or transformation we're saying, unless it brings change at the country level and changes the lives of people, or unless it makes the people we serve healthier, it's not reform or it's not change. And this is the basic principle we're trying to follow, and every change will follow this way: saving lives. Thank you.
Thank you very much, Director General Dr. Tedros. Many thanks to presenters, member states for interesting discussion.